Arizona Republic. After President Donald Trump's COVID-19 diagnosis, Representative Andy Biggs recommended the President and First Lady take hydroxychloroquine, though it is unclear whether doctors advise doing so. In a tweet on Friday, Biggs, RREs, a staunch Trump defender and member of the House Science Committee, offered a video message in which he also said Trump had taken appropriate steps to reduce his risk of infection. Biggs' advice is contrary to guidance from the Centers for Disease Control and Prevention. Trump's behavior is under renewed scrutiny after months of rarely wearing a mask and recent travel that included an event in New Jersey on Thursday after his advisor Hope Hicks had been diagnosed as positive. Those on the left are dancing in the streets. They like to see this type of thing happen, but the reality is none of us should be happy that any of us get sick or have any dangers, Biggs said during the video. In an interview with the Arizona Republic, Biggs, who heads the conservative House Freedom Caucus, said he was referring to ugly posts on social media that delighted in Trump's illness, not comments from any public officials. There was no shortage of Twitter users, for example, suggesting Trump's infection as karma for his handling of the coronavirus pandemic. Polling shows most Americans, including Arizonans, give Trump poor marks for a problem that has killed more than 200,000 in the U.S. and sickened 7 million more. Biggs also offered medical treatment advice for Trump and First Lady Melania Trump different than prescribed by the House attending physician who treated Representative Raul Grijalva, DREs, after his bout with the virus this summer. Previously, Biggs has been criticized by medical professionals for dispensing questionable COVID-19 related health advice on social media and for urging Arizona to unmask. Biggs on Friday recommended that Trumps take hydroxychloroquine, an anti-malarial drug Trump said he took months ago to prevent infection from the coronavirus. I encourage them to get on the regimen that so many experts and doctors around the world have relied on, Biggs said. The observational studies, more than 50, have indicated that early detection of the COVID can best be treated with the hydroxychloroquine, zinc and Z-Pak regimen. I hope that they're able to get that speedy recovery. The Food and Drug Administration determined in June that the drug posed a heart risk to some patients and that it was ineffective in treating COVID-19. That guidance remains in effect. Based on its ongoing analysis of the emergency use authorization and emerging scientific data, the FDA determined that chloroquine and hydroxychloroquine are unlikely to be effective in treating COVID-19 for the authorized uses in the EUA, the agency said at the time.